Hello viewers, warm wishes to all of you who are watching me on this channel. Today I am going to talk about a very common problem which is called appendicitis. Appendicitis, as it is popularly said, it is one of the most common operations done ever since general surgery and GI surgery started. The commonest symptoms are number 1, abdominal pain, number 2, vomiting, number 3, nausea, and this may or may not be associated with fever, sometimes a very undigestive kind of a situation where the patient feels bloated, but pain is the hallmark of appendicitis. Once the pain starts, the pain usually will localize. When I say localize, it will gravitate on the right lower side of the abdomen. Once a clinical impression is made, I will tell you what to do next. The next logical step is to do a couple of investigations. One of the most informative and comprehensive tests for getting into this subject is what we call as an ultrasound abdomen and pelvis, wherein a general scan is made of all the organs in the abdomen. This is a simple test, can be done at any place nearby your residence where you are staying, and it's a non-invasive test. It gives a fair idea about inflammation of the appendix, whether it is ruptured, whether it is not ruptured, or there are any associated issues. If unfortunately the clinical diagnosis and the ultrasound are not matching, or there is a state of dilemma, then in certain cases only we do ask the patient to undergo a CT scan. And these two tests, I think, are more than enough to help the clinician clinch the diagnosis of appendicitis. Along with that, we need certain blood tests, in some specific cases a urine test. If the patient is diabetic or there are other comorbidities of the patient, we definitely like to go and assess those comorbidities. Once this assessment is done, as you all know, the only and definitive treatment of appendicitis is an operation which is called as appendicectomy. In the earlier age, it is to be done in an open method, and now fair number of cases or more number of operations are done laparoscopically. So it's called a laparoscopic appendicectomy. As you know, laparoscopy or a minimally invasive or a keyhole surgery is the gold standard now for treating appendicitis. It is made through small openings in the anterior abdominal wall, through the skin, wherein a camera is placed inside. We visualize the entire abdomen. Sometimes an ultrasound or a CT scan information may not be adequate, and you will be seeing some newer things or some surprises inside the abdomen. Say for example, appendix which has not been really mentioned will be ruptured inside. So all this assessment is quickly done through that camera. There are 2 or 3 other instruments placed inside through what we call as ports. They are small incisions, and with that instrumentation the appendix is taken out. Once that is done, the patient is shifted to the post-operative ward, and usually in about 24 hours time a patient does a nice and good recovery. Subsequently, he or she is allowed to take liquids followed by solid and then actually normal diet. So this was in brief about what we call as appendicitis. If at all any one of you, any of our friends, relatives are suffering from similar symptoms, we actually don't lose anything by at least checking and doing some investigations. Thank you very much.